My name is Courtney. I moved to the Greenville area about 2 years ago. I've actually been suffering from chronic migraines for 10, 12 years. And once I knew that I would be moving down here, I was referred to Dr. Terzella for Botox treatment for the chronic migraines. After my first appointment with Dr. Terzella, we talked about the frequency, the duration, and the kind of the severity of my migraines, and he recommended an additional treatment to add to kind of my protocol called prolotherapy. So after I started to get the prolotherapy, I started coming in every couple of weeks to get the additional therapies, and within a couple months I started to see a significant improvement in my migraines. I've been doing the prolotherapy for just over 2 years now. I come see him every 2 to 3 weeks, just depending on my schedule. And I would say the duration of my migraines, the severity of my migraines has significantly improved. Oh, it means everything. I have 2 small girls. I am running carpool. I'm going to dance. I'm going to soccer. I'm going to golf. They're in everything all the time, everywhere. So being able to really be present for those moments and really be able to be the parent that I want to be to support my children has been a huge, huge difference in my life. I think the realness that Dr. Terzella brings to the conversations, I mean, he starts every appointment with, how have you been? What are you feeling? We've kind of, through trial and error, realized that the weather outside has a pretty significant impact on my migraines. Low pressure, high pressure. Helene was a nightmare. You know, I think he brings a perspective on my treatment as kind of like the whole thing. Like, what else is happening in my life right now? What else is going on that could impact my headaches? And again, the suggestion of trying the additional therapies with the prolotherapy has just made a huge difference for me. Absolutely. I think, again, for chronic pain, I think Dr. Terzella takes this perspective of treating the whole body. So what else are you feeling? Where might you be overcompensating if it's more of a physical pain? We've had all of these conversations, and it's been really, really eye-opening as to how the whole body has such an impact on the pain level. After Helene, again, it was a very specific example, but when I was talking to Dr. Terzella about the headaches, I told him I wasn't sure if it was the actual weather event that was affecting my migraines, or it was the fact that I was home with my children for 12 days straight with no school. And so, you know, he definitely hears what you're saying, and he definitely understands. And every treatment's actually a little bit different. He's always looking at my muscles, or feeling my muscles, and looking at the ultrasound that he takes of my neck to see exactly where those pain points are happening. And so I feel like, you know, every treatment is very specific to the pain that I'm feeling at the time, and it's all very specific to what my needs are. Find a doctor that listens to you. Find a doctor that acknowledges you. Again, I wouldn't be here in my migraine journey if he hadn't suggested this new additional treatment for me. So if it's not your primary care physician, find a specialist. I know sometimes they can be few and far between, but it really will make a difference. If you didn't know me well, you might not know that I have MS. You might not know that I have a migraine. You might not know what I'm feeling right now, because I've gotten so good over the years at just kind of masking. So for me, it's just a lot easier to talk about it with people that I meet. Oh, it's a long story. I have MS. It drives migraine, or sometimes it causes migraines, or migraines are a secondary symptom of the MS. So it's really easy for me to just kind of wash it away, or just kind of skip right over it, rather than going into the whole long drawn out story of it. So again, getting that initial acknowledgement from a medical professional saying, you have MS, that's probably why you've been having these migraines for years. And understanding how those two are interconnected. And again, just getting that acknowledgement, understanding somebody sees me, somebody hears me, and somebody is acknowledging what I've been going through. You know, again, just be open. Be open to the discussion, whether it's, you know, a friend in the neighborhood that might be going through something similar, or it's your general, you know, your general practitioner, but you never mention like all of the stuff because you have a lot of stuff and you don't want to seem like you're overly complaining. But that's how you will be heard, and that's how you could potentially get to a place where if you know this doctor knows of this doctor, maybe go see them and see what they have to say. It might not be your GP's specialty, but they may know of a path that could take you to somebody who is a little bit more of an expertise in that area. And because, you know, every headache is a little different, but you can tell like where a sinus headache is, you can tell where a tension headache is. But my migraines, they are always in the same place. They start behind my eye and they wrap. And as soon as I've said that to different doctors, like as soon as I talk about how they wrap around, there's something about that they're like, okay, that's a little bit different than some of these other types of headaches that we talk about a lot. It hurts to open my eyes. It hurts to take a deep breath. Going from, and sometimes that's the worst, is if I wake up with a headache, the initial move from laying down in bed to sitting up, and it's almost like the blood rushes and you get really dizzy, you get a little lightheaded, you get a little, those auras kind of in your eyesight. And usually the reason why I'm getting up is because there's a small child in my room that either needs to, you know, they need their breakfast, they need their lunches packed, they need their backpacks ready. So just going back to bed is not an option.